When you're building a house, you need to make sure that you've got a good, solid, firm foundation. It's the same as when you're working with neurotransmitter imbalances. We still need a firm, solid foundation upon which to build. And in the case of the Neurograph, we're suggesting activated B3, omega-3 fish oils, both DHA and EPA, and also Cognisense. And it's absolutely critical that they are supplied, as we'll see. Activated B3 is vitally involved in this whole process because what we need to do is to make sure that every cell of the body, particularly in the brain, is producing enough energy. And this is one of the problems with people when they're having mood disorder problems, is quite frequently brain energy production is down, particularly in that left prefrontal cortex when there's depression. And so we need to put in nutrients that are going to really increase that energy production, and that's where activated B3 comes in. Not only does it do that, it also works down at a much deeper level than that. For example, it also helps to boost levels of things like serotonin, dopamine, noradrenaline. There are other nutrients, of course, such as we find in the pre-dope and the pre-GABA, etc., and also the 5-HTP, which help in the production of those particular neurotransmitters. But activated B3 works at a different level altogether again. Just to give you an idea of the power of activated B3, let's just look at a couple of very, very nasty conditions which usually just do not respond to medical treatment. For example, Leigh disease is an inherited disorder, as it says here. Usually affects infants between the age of 3 months and 2 years, but in some rare cases, teenagers and adults as well. Now, with this condition, mutations in the mitochondrial DNA or in the nuclear DNA and some other areas, you get a problem with motor skills. You get a degradation of the motor skills, and eventually this can lead to death. Affected children may experience vomiting, seizures, delayed development, muscle weakness, and problems with movement. Heart disease, kidney problems, and difficulty breathing can also occur in people with this disorder. Now, activated B3 has been used to help patients with this condition. And a case in point is a little 5-year-old guy, Noah, with Leigh disease, and he has responded very well to activated B3, which is not unusual. He's improved a lot. He's got more energy, more sustained energy, which is supposedly impossible with this particular condition. It's supposed to be the reverse. Better concentration, continued development, and is leading a more normal and active life. He has just one activated B3 a day. Another condition which is notoriously difficult to treat, of course, is Parkinson's disease. Two very high-profile people with the condition. One is Muhammad Ali and the other is Michael J. Fox. I've been using it on several different patients with Parkinson's disease, and the invariable response to it is that the people improve, the tremors recede, and they feel one heck of a lot better as a result. And here, for example, is Lena Story, a patient of mine. She's from Melbourne. She's had Parkinson's for 14 years, 42 years old when diagnosed. She's been taking an activated B complex as well as activated B3. And the symptoms of Parkinson's have subsided dramatically. She's also got one heck of a lot more energy. And she says here, my uncle recently was diagnosed with Parkinson's disease, and he too started taking activated B3 and activated B complex and noticed an improvement being able to cope with daily activities. And another condition is Huntington's disease, another movement disorder. It's an inherited progressive neurodegenerative disease that affects both body and mind, characterized by jerky involuntary movement, sometimes referred to as Huntington's chorea. These people often undergo personality changes, depression, and have a progressive loss of mental capacity to the point of dementia and mental retardation. Activated B3 is able to protect and improve the functioning parts of the brain that are affected by Huntington's. And in fact, one patient who was taking the product put onto it by a naturopath over in Perth, he was diagnosed about 6 years ago with Huntington's disease. And he was seeing specialists and getting follow-ups, etc. And after he went on the activated B3, after a few months, his symptoms improved one heck of a lot. And in fact, the last time he was checked, which is only a month or two back, by the specialist, he's got no signs currently of Huntington's. It's also used in formulas for treating Down syndrome, which it does very effectively in the formula called Nutri-21. Brilliant formula, and activated B3 is a critical part of that formula. So it's also used in conditions such as ADHD, ADD, autism, Asperger's, Alzheimer's, dementia, just to mention a few. And definitely used in treating depression. Another important product that we need to use as part of our foundation nutrition program is Cognisense. Cognisense contains a range of amino acids. It's also got a range of activated B vitamins. It's got zinc. It also has magnesium at a good level, calcium at a good level, as well as CoQ10 and antioxidants. Very, very high quality, very important to use this whenever you are treating anything to do with the mind whatsoever. And the usual dose is a teaspoon 2 or 3 times a day, 1 level metric teaspoon 2 or 3 times a day. If people are a bit reluctant to take a powder, it's a very pleasant tasting powder with a very nice berry flavour. You can give them in its stead activated B complex capsules together with magnesium citrate capsules. They don't get quite the same amount of the nutrients or the range of nutrients as we get in the Cognisense, but at least you're going to get them to take the absolute basics that they require. Now, depending upon the severity of the condition that you're trying to treat, you sometimes need to go a little bit further in respect to boosting energy production and brain function. Now, one of the things to use is acetyl-L-carnitine. And this can definitely help with energy production, cardiovascular function, memory and cognitive function. It helps to make the little powerhouses in every cell of the body that we need to produce our energy. It makes them a lot healthier and younger. So acetyl-L-carnitine can have enormously great benefit when you're dealing with any kind of mood disorder problem, particularly when it's associated with low energy, either mental energy, which can lead to things like difficulty with concentration, cloudy, fuzzy thinking, or just general body fatigue as well. And here is the activated B complex that I mentioned earlier, which you may have to use if the patient isn't prepared to take that pleasant tasting Cognisense powder. And here is another product as well that we may need to consider depending upon the severity of the condition that we're treating, and that is the R-alpha lipoic acid. Very potent antioxidant properties, not only in its own right, but also helps to regenerate and recharge things like vitamin E, vitamin C, and glutathione. And it really helps produce more energy within the body, as well as protecting the brain and also improving mitochondrial and energy function generally. Another vital part of the foundation nutrition is the omega-3 fats, both the DHA and EPA. And studies have shown that in populations where more omega-3 oils are consumed, particularly in things like fish, the incidence of depression and bipolar disorder goes down enormously. It says here depression is 60 times higher in New Zealand, where the average consumption of seafood is 40 pounds a year, compared to Japan, where a person consumes nearly 150 pounds of seafood a year. Then it also says here that postpartum depression is 50 times more common in countries with low levels of seafood consumption. Of course, during pregnancy, a woman's body becomes depleted in fatty acids, particularly these essential fats which go into the baby. The omega-3 oils seem to be crucial and critical for the growth and maintenance of brain cells, especially the cell membranes themselves. And of course, the famous 1999 Harvard pilot study supports all this information.